edition. Now, research points to the fact that 70% of infectious diseases that affect people start in animals. These zoonotic diseases have been responsible for all recent outbreaks and pandemics that have threatened our global health, including COVID-19, HIV, and Ebola. New zoonotic diseases are emerging at an alarming rate. In their natural habitat, these diseases pose a threat to people circulating harmlessly within wildlife populations. But by bringing people, livestock, and wildlife into unnaturally close contact, we increase the risk of dangerous diseases spreading to us. Tonight in Health Focus, the Director of Public Health at the Ministry of Health, Dr. Kyabayinze, explains what they are doing to prevent future outbreaks.
Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
The diseases which are bound to be pandemics are diseases which can quickly spread from one person to another by contact, by aerosol, infectious disease, especially when they are viral in nature, they can quickly spread. And a pandemic is when an outbreak is noticed, it's not managed, it becomes an epidemic, the geographical location increases, and then it becomes a pandemic when it moves from one country to another, and it can be spread by people through trade, movement, export. So those are the diseases which have potential to become pandemics. And especially it can become pandemic if there are no known vaccines to prevent rapid spread and infection breakout. The country can only be prepared to prevent the diseases which can be contained. So to what extent are we prepared to handle a pandemic? When there is a disease outbreak anywhere, we should be keen and start following whatever breaks out, like what we are doing here in Mutukula today, is that if there is a disease outbreak in Tanzania, we are prepared to prevent or respond immediately. Secondly, we must put a stockpile of vaccines for those diseases we know that can cause pandemics. Thirdly, we must be able to communicate with the people and continue us with the routine vaccinations, because even these vaccinatable diseases can go out of hand and then spread. Secondly, we should be tracking the antimicrobial resistance, that the medicines we are using are effective and able to respond to whatever diseases are in the community. So the interaction we need to change is to make sure we have standardized way of monitoring what is happening in the animal health. The people in the One Health platform spearheading the interactions are always tracking. For instance, people should not be eating wild game. When there are animal outbreaks, there should be restrictions in how people move animals. That's why we know that Ebola, at least, and Marburg are found in bats, fruit bats, and fruit bats share the fruits with the rest of the humans. So we know that we can do something to prevent that. Secondly, as we do research and innovations, we should alert people in how to report quickly. The community should be able to report quickly if there's any strange disease, and then make sure that our scientists are developing innovative ways of having vaccines or treatment so that an outbreak happens, it's quickly handled.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store, and distribute essential medicine and medical supplies to all government health facilities in Uganda.